We're going to turn now to the growing fears over the so-called tripledemic of flu, COVID, and RSV. Adult hospitalizations are now at levels not seen since the Omicron surge a year ago. Our chief national correspondent, Matt Gutman, is in Los Angeles, where cases are pushing some hospitals there to the brink. Good morning, Matt.
Hey, good morning, Robin. That trio of COVID, flu, and RSV are surging here in California, prompting health officials here in LA County to consider bringing back the indoor mask mandate. And flu hospitalizations have nearly doubled compared to the past week, and it's left pediatric wards at hospitals like this at or over capacity. This morning, health officials sounding the alarm as the tripledemic of RSV, flu, and COVID wreak havoc on our nation's hospitals and patients of all ages.
Right now, it's just another ambulance came in. That's 1, 2, 3, 4, 5, 6, 7, 8, 9.
Yes. This is not unusual for this winter. It's just been relentless. We're just seeing so many acute cases coming in all the time.
Over the last 3 days here in Los Angeles, nearly 10,000 new cases of COVID-19 were reported in the county, along with 28 deaths. LA County, the nation's largest, seeing a faster than expected rise in COVID, now considering an indoor mask mandate. 44 states, as well as D.C. and Puerto Rico, reporting very high or high levels of influenza-like activity. Health officials now warning that adult hospitalizations are surging to alarming levels. With 80% of adult hospital beds full, this is the highest adult occupancy since last year's Omicron surge. Flu-related hospitalizations, the highest for the time in the season since 2010. New York City seeing very high levels of flu-like illness for the 5th week in a row.
These numbers are spiking way too early compared to historical trends. And we have 27,000 positive cases right now.
Children particularly vulnerable. Rishma Shan's pediatric hospital has been near 100% capacity.
The emergency rooms are inundated with all types of, just respiratory infections. But our pediatric floors and our ICUs have been full all across the country and in Los Angeles.
I've asked health officials, maybe we're just seeing the peak earlier this year and the numbers will soon start to decline, but they say that is almost certainly not the case because people are going to start to travel and gather in large groups in December and then in January, and that's when things tend to get bad. Now, they say the best advice they can give, since RSV and all these viruses tend to live in droplets, is just wash your hands frequently, try to wear a mask, and if you're sick, stay home. George.
Good advice. Matt, thanks very much.